Welcome to Elite Expert Insider Podcast, where we will inspire, motivate, and educate entrepreneurs, innovators, and growth seekers. Brought to you by Elite Online Publishing, making the best and brightest in the industry #1 best-selling authors. 80% of people say they want to write a book. We're assuming that's the same for you. If so, contact us at www.eliteonlinepublishing.com and make your book a reality. Hi, it's Melanie Johnson along with Jen Foster. Hey, Jen, how you doing?
Doing great. How is everyone today?
Good. Well, listen, we are going to talk about some interesting stuff, one of which is erectile dysfunction, just to get your attention, right? How to fix that if you have a man in your life that's looking to fix that. But we have an expert doctor that is going to be talking about stem cell therapy who wrote the book, Erectile Dysfunction Fix. But she is a specialist in cosmetic and sexual medicine and regeneration. So using stem cell therapy. And I have heard so much about this. I've had a friend of mine that has used it. I'm considering having my dad use it. So I'm really curious to learn about it. And Dr. Ann Truong is an expert at this. So Dr. Ann, welcome today. Thanks so much for coming.
Well, thank you for having me.
Well, Dr. Truong, tell us a little bit about how you got to this point where you are an expert at the PRP or the rich plasma treatments.
Well, it's actually a long around way, but I actually discovered acupuncture when I was practicing, and I'm by nature a pain management physician. And I felt that I felt I was not doing my patient justice by giving them opioid medication or giving them a medication that make them groggy and alter their mental status. They couldn't function, they couldn't work. So I wanted to learn about acupuncture as a form of treatment for my patient for pain alleviation and well-being. So from learning about acupuncture, then I learned about your own stem cell that you have in your body, because that's really what acupuncture does. Acupuncture actually helps you by increasing more stem cell circulation in the body. So from there, I learned that in your body, you have your own blood, which is the healer of everything you have. That's what heals you when you have a cut, and that's what heals you when you have surgery, is your blood. And then you also have stem cells that is in your bone marrow, that you need to use every time you have a broken bone. And then you also have stem cell in your fat. And a lot of plastic surgeon uses fat transfer to put it into the face or the chin to regenerate tissue, the firm tight tissue. So by understanding that you have your own autologous stem cell, you can actually use it for many applications to help you heal or to help repair a function of an organ or tissue. And part of that is then one of the things, that's why I wrote my book about, was to use your own blood, which has platelets in it, which is involved in clotting of your blood. And when you isolate that from your blood, it actually stimulates your tissue to generate more blood vessels. And therefore, if you put in platelets, which is from your blood, into an area, it stimulates more blood vessels, and therefore it can help you heal from either an injury, like a rotator cuff tear, or even help you from your knee or your hip pain or your low back pain, and also from fixing erectile dysfunction, and also for female, for even urinary incontinence, by just regenerating more healthy tissue. So it has many, many applications, from pain, into your joints and your muscles, your ligament, into your skin for cosmetics, and into the tissue of the genitals to regenerate and firm tissue, and also to bring in more circulation. So many, many applications of that. So it's an alternative to surgery, is what the key point is, that now we have the capability to isolate the healing tissue of your body and to understand it more than we've ever been. Now it's consideration before you do surgery to give to tap into your healing power of your body.
Wow, I love that you named so many things that this can help. And it's not just, I mean, you did write about erectile dysfunction for your book, but it also helps all these other things, and we can help ourselves with our own blood platelets. I think that's awesome. So let's dive a little bit more into your book a little bit. So I noticed that, of course, it's going to be better because you're not using any drugs, right? You're not using any pills to help you. So you're using your own blood and platelets. But what it says here on your book that it's called a PRP shot. So
Yes.
would men be scared of that because it's a shot? Like, how does that all work?
That
Yes.
sounds kind of painful to me, the whole process. I want to hear the process of, how do you take the platelets? Do you just take blood? Do you have to get bone marrow? It sounds like I was going, ouch, in my mind a few times,
What we do is we make it a very, very tolerable experience. Of course, before we do that, we give you a little medication, and we give you, give some pain medication to make it very tolerable. And then, and believe it or not, essentially, if you're just going to get the platelets, it's really coming from your blood. So it's no different than going to the lab and getting your annual checkup to check your cholesterol and so forth. It's like getting blood from your veins. And then what we do is we put the blood in a centrifuge and we spin it at a certain rate, and that separate out the red blood cell from the platelets from the white blood cell and from the proteins in your blood. So after you spin it, you just isolate out the platelets and and then inject the platelets into the area of injury. So with the Priapus shot or short P shot, what that is, it's injecting the platelets into the male penis to regenerate blood vessel. But you cringe, but believe it or not, we actually do a nerve block before that. So it sounds awful, but it's kind of like when you go to the dentist and he numb your mouth up, and then he drills into your mouth and he pull out the tooth.
It's not as bad as it sounds.
No, it's not as bad as it sounds because we really numb it up. So of course, to do it without numbing it will be torture, but it's actually very tolerable after you numb. Imagine kind of like when you go to the dentist, numbing your mouth up.
So not as bad as it sounds.
Yeah.
So what's the difference then? So you were saying like for knee injuries and different things. So I hear people always say they're going to go and get something done to their knee where they're going to get injections. Is this what they're talking about? Is these PRP treatments?
Well, it's a variable. You have PRP, which is from their blood, and then there's now something too that is labeled stem cell, but it's really not quite stem cell, and that's amniotic fluid or amniotic tissue or placenta. What that is just tissue that comes from the placenta, which is, as you know, from a mother who gave birth. And what they do is they sterilize and isolate it. It comes in a powder, but that's not living cells. That's just dried up tissue that does have some anti-inflammatory effect to it. But when you inject it into a painful area, so it does reduce inflammation, but it doesn't regenerate tissue.
So they might be going to get stem cell injections, but that's only going to relieve the pain. So they really need the platelet-rich plasma.
Yes.
That makes sense.
Nothing is better than your own live tissue.
Yes, I love that.
Your own, right? It can't be somebody else's that has the same blood type.
No, it has to be your own. And the processing of the blood and to the final product takes, depending on what machine you use, what kit you use, can take from about 5 minutes to about 20 minutes.
So not a very long process.
No, not very long at all. So you come in, you come out, you're out of there in about an hour.
I love that we're actually looking at our own bodies we know what we can heal our own bodies, or else when we get a cut, it would stay forever, right? So I love that the technology today is actually looking at ourselves, healing ourselves, instead of looking at all these drugs and different things that are going to give us all these side effects.
Absolutely. And that's what I'm passionate about, I'm passionate about spreading that message that our body, we're now just beginning to understand the power of healing within our body. We know that we can heal ourselves, like we do a cut when you're cooking or something, you cut your hand, it actually heals in a week or so. How does that happen? That's actually the platelet doing the work. So now we need to understand that we need to harness that. We know now probably 1% of what we need to know about healing and stem cell. And every year we know more and more and more. We do know that we can help with arthritis pain of the joints and the knees, the hips, the shoulders. Now with the stem cell therapy, stem cell from our bone marrow, fat, and PRP, we know now how to help regenerate muscles and tendons and ligaments, like in the rotator cuff tear, and also like in an ankle sprain or elbow tendonitis, things like that you always tend to take, ibuprofen for and wear a brace. And then if that doesn't work, you do therapy. And then if not, you do surgery. So now we can totally regenerate tendons and ligaments now. And also try to calm down the inflammation of the joint. I believe in the future, we will be able to regenerate cartilage and the damage from the arthritis. And the good thing about the future is that it holds a lot of promise for us to probably live up to 120, 130 years old. So more focus to taking care of the body you have now. So be there to take care of you when you're like 120.
Yeah, we got to keep working. And so we've talked about erectile dysfunction, but what about vaginal rejuvenation?
Oh, yes. Now, I'm not embarrassed to say I had that done because several years ago, I had urinary incontinence because I was entering into menopause. And the first thing that goes with menopause is that your muscles start to get lax, and things just start falling apart, literally. Gravity will pull you. So I couldn't exercise. I couldn't run on the treadmill. I couldn't play tennis. And it was embarrassing to having to go to the bathroom all the time. So there is a female version of the Priapus shot, which is called actually the orgasm shot or the O shot. But it's named as an orgasm shot, but it's really not for orgasm. It's actually using the platelets to actually rejuvenate and regenerate the vaginal muscle tissue. And at the same time, it also can stimulate clitoral sensation. So to get a little bit more beta attention, it's called the orgasm shot or the O shot. But it's really the main indication is to treat urinary incontinence in female, during or before menopause, as well as can also help with pain from women that has given birth and has scar tissue down there and it becomes painful, or even vaginal dryness. So those are the conditions that before had never been treated, has always never really been mentioned, but now it can be treated and reversible with the platelets.
So that helps. Does that help with endometriosis as well?
Well, that's a very good question. Endometriosis, as you know, is more into the pelvic area and into the uterus. So we're still looking at that, but I don't see any reason why it couldn't. I would like to see us as physicians here in the United States to be able to do platelets infusion. But right now, we're not allowed to do that due to several regulatory guidelines. But I think that with platelets infusion, that may help with endometriosis.
Yeah. Well, that's great what you said about for women. Like I know people, even not in menopause, when they're playing tennis or they can't jump on the trampoline with their kids because their kids were all 10-pound babies, and it just doesn't work like that. And they get the hammock or whatever, but it doesn't work. So
no, it doesn't. When you take medication, it dries you up, and it still doesn't work. So the medication has a lot more side effects. So, and I have 3, and I've never looked back again because I'm enjoying my life. I don't have to worry about going to the bathroom every 1 hour or something.
Yeah.
Yeah.
Big issue. And I'm surprised
it's very, very common.
Because I would think it's more muscle related. So I'm surprised that it also helps with lubrication.
Yes, it does. It does. Yeah. Because there are glands next to the muscle. So when you're regenerating the muscle, the glands also gets regenerated as well. So it's actually a treatment for vaginal dryness.
So it's like a one-stop shop for everything.
There you go.
Well, it's almost, yeah. The key is to know that it's there and to seek the treatment and seek the right treatment with the right professionals that are trained to do this.
Are there any side effects with any of this that you've seen or read about?
No, not at all, because it's your own blood. So it's your own blood, and if there's any side effects, it's really more, in pain from the injection, or with any injection, there's a possibility that you may have infection. But other than that, there's really no known side effects at all.
That's great.
Yeah.
That's amazing.
Yeah.
And then how are you seeing it used? I mean, with joints, and is it becoming more of, I guess my question is it becoming more of a widespread practice? Are you seeing it growing and it's becoming more of the mainstream?
I definitely see that physicians are starting to see this as as an alternative to medication and pain medication. Definitely, I'm starting to see that but more physicians doing this. So definitely, not so much mainstream, but I think that's definitely picking up pace. So by doing this, it's not that easy. You have to have several years of training. You have to understand the how the blood works, and you have to understand how to isolate that. So to be really good at this and to know what you need to use, it takes several years to really get you feel comfortable in doing that. So it's definitely picking up traction, more widely known. Have any of you heard about platelet-rich plasma prior to today at all?
No, I hadn't. I mean, I always hear people telling me they're going to go get stem cell injections or some kind of injections, but
Yeah.
but they haven't talked about the had said the words the platelet regenerate. Is that what it regeneration?
Platelet-rich plasma.
Oh, rich
Yeah.
plasma.
Yeah,
Yeah,
platelet-rich plasma.
I haven't heard of it. So
Uh-huh.
what kind of a doctor, or like you're a specialist in this? How does someone ask their doctor or find out who could help them? And you're in what city are you in?
I'm in Fredericksburg, Virginia,
Okay,
which is
so you're in
about an
Virginia.
hour south of DC and an
Mhm.
hour north of Richmond.
Okay. Well,
And
it's more and more common now to travel for services for medical
absolutely, yeah. And
tourism.
we see patients all over the world. Actually, I have a patient from all the way from Germany and
Mhm.
patient all over the United States. And it's actually a fairly benign procedure in the sense that you come in, we do an evaluation remotely, and then you come in and we get your blood, and then we do the procedure and they leave, and then we follow up by really teleconference and telemedicine at that point. And you the downtime is very, very, very minimal. Let's say if you're going to get this for either for the female or the O shot, the P shot, you can literally go back to work like that same afternoon. And we can do this to regenerate skin on the base, to get rid of the wrinkles and the brown spot, make you look younger, give you that nice glow. You could do it over lunch. It takes about an hour to do, and when you come out, you look like you just had a tanning session, just a little, rosy cheeks, and you nobody will even notice the difference. However, if we were gonna do this into the knee or the hip or the shoulder, it's really about a 3 day rest. I would tell
Yeah.
patients to kind of take it easy for about 3 days. But if you compare this to doing surgery, where you may be off of work for several weeks at a time, and the time lost from work and the wages that you lose from that is almost sometimes priceless. Versus when you get the platelet-rich plasma injection, you're looking at very minimal downtime and you're back to work again. So I tell people, do this on a Friday, and if you do a desk job, you go back to work on a Monday.
Yeah.
And if you do, physical labor job, you may just have to modify your activity, but certainly it shouldn't be something that will take a long time to recover.
What do you think? I mean, should you go to body specific parts? Like my boyfriend he was at his ankle doctor and he did his ankle. Should I go to, if it's for the O shot, I should go to my OBGYN or someone who specializes in that area of the body. If I'm doing the face, I should be going to a face specialist.
No, not at all. You can go to a physician that specializes in stem cell therapy that can do it all. That can do the joint, do the face, and some can even do the O and the P shot. Now, I also train physicians as well on these procedures for the PRP for the face or the for the male or the female sexual rejuvenation. So they have to have the training and the certification to do that. But for someone like myself, and I know of several of my colleagues around the country, where we do everything from joint to cosmetic to sexual application. So the good thing is you bring up a good point is to do your investigation on who you go see, and make sure that they've done it for at least they've done it for at least 3 years. and that ask questions and where they've been trained. There's an association called American Association Orthopedic Medicine, AAOM. That is most of the physicians in that organization are trained in the orthopedic with the PRP procedure. But for the aesthetic and the sexuality, that's like another step of specialization. And that's something that you have to kind of call the office and inquire about, or certainly call me. And I know a lot of people around the country and can certainly steer people in the right direction.
Great. Well, where can people find you, Dr. Truong?
Yes, I have a website. It's the www.Truong Rehab. It's spelled TRUONG. Rehab REHAB.com. And we're located in Fredericksburg, Virginia.
Awesome. Well, we'll put that link up at the bottom. Thank you so much for all of your knowledge today. And please, everyone listening, reach out to Dr. Truong on her website, truongrehab.com, if you want to know more and to hire her to speak. She does speaking as well.
Well, thank you very much for having me on the show. It's a pleasure. And also, I wanted to help the listeners that they can go on my website and actually download a free copy of the book. It's listed on the website. Just go in the tab says book, and they can get it downloaded. And it's not talking about just erectile dysfunction. Talk about using stem cell therapy for anti-aging, essentially, for men and women.
It's like you want to go, if you're going to go get it all done. Get the face done. If you get the other, the lower and the and the upper part of the body, get it all done.
God, we're going to live up to 120. Might as well take care of yourself now, you know?
That's right. That's right. Hey, and I forgot to tell everyone, make sure you subscribe to this podcast because we're always bringing you awesome guests and enlightening you, educating you, inspiring you, and motivating you to be better every day. So remember to do that. And if you're looking to write a book, make sure you check us out, Elite Online Publishing. You can go there to eliteonlinepublishing.com. We have over 60 authors now, and we have made every single one of our authors a #1 bestseller on Amazon. And we help brand you as an author and help your book sell things for your business. So connect with us. We'd love to hear from you, and we'll see you next time.
Bye.
Thank you. Bye-bye.
If you'd like to create the most powerful advertising tool for your business, contact us at eliteonlinepublishing.com, where we will help you create, publish, and make your book a #1 bestseller and show you how to get new leads and more revenue for your business. If you'd like to check us out on our Facebook page, we have a free book for you as our gift. Just go and click free book. Remember to subscribe and leave a comment for our podcast. We would love to hear from you.